Hey there and welcome. If you or someone you love is navigating hepatitis B, you know that all the medical tests and numbers can feel, well, pretty overwhelming. So today, we're going to clear things up and talk about one of the most important tests you'll encounter, the HBV Viral Load Test.
So maybe you've just come from the doctor's office with that lab request in your hand. Or maybe you're staring at a report right now, trying to make sense of it all. It's totally normal to feel a bit confused or anxious, but you've come to the right place to get some answers.
All right, let's just dive right in. My goal here is super simple. We're going to break down exactly what this test is, how it's done, and this is the most important part, what those results really mean for you and your health. The more you know, the more in control you'll feel. Okay, so first things first, what in the world is a viral load? It sounds pretty serious, I know, but the idea behind it is actually really straightforward. To put it simply, the HBV Viral Load Test is a blood test that literally counts the number of Hepatitis B virus particles floating around in a tiny drop of your blood, just 1 milliliter. So it's not just a yes or no for the virus, it's telling you exactly how much of it is there. And this is a great way to think about it. Imagine the virus is like a tiny little copy machine inside your body. The viral load number tells your doctor how fast that machine is running. A really high number means it's just churning out tons and tons of copies, while the low number means the machine is barely switched on. And that's exactly why this test is often called the decision maker. For anyone who is HBsAg positive, meaning the virus is definitely active, this number is probably the single most important factor that helps your doctor decide what to do next. Is it time to start treatment, or can we just keep a close eye on things for now? This test helps answer that. So you go in, you give a blood sample, but what actually happens to it after that? Let's pull back the curtain a little bit on what goes on in the lab. Honestly, understanding the science behind it can really make you feel more confident in your results.
The technology they use is called real-time PCR, or RT-PCR for short. Now, this is the absolute gold standard in this kind of science. It's known for being incredibly precise. It's designed to find and count the virus's genetic blueprint, its DNA, even if there are only tiny amounts of it.
The whole thing happens in 3 basic steps. First step is extraction. The lab techs very carefully pull out just the viral DNA from your blood sample, leaving everything else behind. Then comes the really clever part, amplification. They use these special little molecules that act like magnets, finding only the hepatitis B DNA. Then they make millions and millions of copies of it. This is what makes the test so sensitive. And finally, quantification. As each new copy of the DNA is made, it gives off a tiny flash of fluorescent light. A machine is right there counting those flashes in real time, which lets it calculate the exact number of virus particles you started with. Pretty cool, right? Okay, now for the part I'm sure you've been waiting for. Let's talk about how to make sense of that lab report when you get it. This is where all that science turns into something practical for you. So when you look at your report, you're going to see a number followed by IU/ml. That stands for International Units per Milliliter. This is the global standard, which is great because it means a doctor in any country can look at your report and understand it the exact same way. Generally, your number will fit into one of these 3 main buckets. If it says undetectable or BDL, that is fantastic news. It means the virus level is so low, the machine can't even find it. That's the ultimate goal of any treatment. A low viral load, under 2,000, usually points to what doctors call an inactive carrier state. And a high viral load, anything over 20,000, tells us the virus is very active. So let's focus on this for a second. A number under 2,000 IU/ml suggests the copy machine we talked about is running very, very slowly. Now, this is a great place to be, but it doesn't mean you can just forget about it. Your doctor will definitely still want to keep an eye on your liver health regularly. On the flip side, getting a number over 20,000 IU/ml is a really clear sign that the virus is highly active. A high viral load over a long period of time can lead to chronic inflammation in the liver. Over years, this can cause scarring and damage, so this is usually the point where your doctor will start a serious conversation about treatment options. Oh, and just a real quick note on this. While IU/ml is the standard now, you might occasionally see an older unit called copies/ml. Don't let it throw you. They're measuring the same thing, just on a different scale. The most important thing for you and your doctor is to watch the trend. Is your number going up, down, or staying stable over time? So now that we've decoded the numbers, let's kind of zoom out and look at the big picture. Why does this one number really matter so much? Well, it's because it's never just about one single number. Your doctor is kind of like a detective. Your viral load is a huge clue for sure, but they combine it with other key pieces of evidence. They'll also look at your HBeAg status, which tells them how infectious the virus is, and your ALT levels, which is a test that shows if your liver is inflamed. All these pieces together give them the full story. So if there's one thing to take away from all this, it's this. Your viral load number isn't some final grade or judgment. Think of it more like a roadmap. It's a powerful tool that helps you and your doctor make smart, proactive decisions together to keep your liver as healthy as possible for the long haul.
And that really brings us to the most important question. Now that you have this knowledge, you can go from being just a passenger to being a true co-pilot in managing your own health. So talk to your doctor, ask questions about your results, and be a partner in your own care. Understanding your numbers is the very first step to taking control of your future. Thanks so much for joining me.